1. Gender-based employment disparity new development goal, more women in workforce. GS Paper 1, Role of Women and Women's Organization, Population and Associated Issues, Poverty and Developmental Issues, Urbanization, Their Problems and Their Remedies. Why is it in news recently? Hardly 16% of the workforce in Mumbai comprises women as per the latest census data. Months after research data showed that the country is missing out on economic benefits of strong female participation in the workforce, Mumbai has decided to give a push to draw more women into gainful employment by guaranteeing them better and more equitable access to urban services. Why is women's labor force participation dropping in India? These low rates are largely due to cultural attitudes and social norms about women in the workplace. It will affect it in the regions where women traditionally enjoy a lower status in society. The lack of safety and supporting infrastructure plays a role in deterring many educated, urban women from pursuing careers. The global financial crisis and deficient monsoon rains may have also contributed to the decline. A high wage gap between men and women for the same work also acts as a deterrent. Concerns. Failure to allow women full access to the labor market is an underutilization of human resources that holds back productivity and economic growth. What are the steps taken in Mumbai to bridge the gap? The city's revised draft development plan proposes a slew of initiatives and policy efforts to bridge the vast gender gap in workplaces. Maharashtra also follows a nationwide trend where urban women lag behind in participation in the economy, with heavily urbanized areas such as Mumbai, Thane, Nagpur and Roygad performing the worst on this count. Provisions have also been made to set up 24 new skill centers or Aadhar Kendras, one in each ward, for women, presumably for skill development purposes. There is another proposal to set up dedicated areas, minimum 5,382 square feet, for women vendors in each ward. If the revised development plan is implemented in letter and spirit, the city will have a care center or a counseling facility for women in each of its 227 electoral constituencies. The municipality has claimed that it has drawn up plans to set up more public toilets. 2. Primary care, the first line of defense. GS Paper 2, Issues relating to development and management of social sector, services relating to health, education, human resources. Why recently in news? A recent report of the Parliamentary Standing Committee on Health has deplored the persistently low levels of funding for health over several years. It observed that funding that was held back could have been utilized to improve primary health services and improve India's lagging health indicators. The Director General of the World Health Organization, WHO, Margaret Chan, has called for universal health coverage led by people-centered primary health care. Primary health care services help to promote health, prevent disease and detect disorders early for effective treatment. Significance of primary health care. Primary health care services help to promote health, prevent disease and detect disorders early for effective treatment. By preventing serious complications, they contain overall health expenditure and improve population health outcomes. They also assure continued ambulatory care when patients return from tertiary or secondary care hospitals. They reduce doctor dependency of the health system. Much of primary care can be provided by trained community health workers, nurses, and allied health professionals. Technology-enabled frontline health workers can operate even in remote rural areas where doctors are not available. They also provide a close connection between the community and public health, with an opportunity for people's participation in the design, delivery, and monitoring of health services. Why we must start revitalizing primary care in a new paradigm. The new global construct of primary care differs from the distorted practice of the past. The vision of comprehensive, integrated care was fragmented by vertical health programs and donor-driven selective primary care. It has been recognized that even well-intended, vertical programs cannot be successfully force-fitted into weak health systems. This has now led to fresh advocacy for comprehensive primary care as the foundation of a strong health system.